Testosterone replacement for men with low testosterone helps with energy, weight, sleep, strength, and sexuality. Allure is a leader in the industry for aesthetic medicine with over 20 years of experience. We are joined by Dr. Charles Moak, who's an author and an expert in men's health. Dr. Moak, we're excited to have you on this morning.
Thank you, Megan.
Yeah, well, your book title, it catches everybody's attention. Our producer's
Yes.
like, I want to read that.
Yeah, the book is titled, If Your Testosterone is Low, You're Going to Get Fat, and 17 other things the FDA doesn't want you to know about low testosterone. And, you know, we know women go through menopause, and it's really obvious when it happens. There's, no more periods for a year, and for men, it's more insidious, it's more subtle. And we have a testosterone, which is our kind of our maleness hormone. We have a much higher level. And as it declines, we start seeing the health effects that we might consider aging, like weight gain, decreased energy, decreased stamina, decreased sexuality, decreased awareness, maybe depression. And it's very simple to replace. And it's been around, been FDA approved since the 1950s. But right about 15 years ago, the FDA kind of shot down marketing testosterone directly to men with low testosterone because the original indications were for men that were missing part of their brain or a testicle or had an extra female chromosome. But now we know that there are other reasons to use besides that. And the big data came out in the past 10 years showing that men with low testosterone, if they're treated, not only they feel better, but they actually appear to live longer and have way lower cardiovascular rate. A large study done in 2016, 86,000 men followed for 8 years with low testosterone. If they didn't replace it, they were twice as likely to be dead in the next 6 years if they didn't treat it. And really, as doctors, we've not been really paying attention to this because it's not heavily marketed. This is a generic medication. It's widely available, very inexpensive, and it can promote weight maintenance, preserve bone mass, muscle mass, preserve energy, vitality, sexuality, more awakeness, more alertness, less depression, and it's very easy to replace. But again, because it's not promoted much, we kind of forget about it, and we treat all the conditions related to aging instead of treating maybe one of the predominant one of the root causes.
So how do, if someone's watching is like, all right, what do I take a pill? Is it a pellet? What do you do? What is the treatment?
Yeah, so first off, you see your doctor and get tested. We offer this at our clinic, Allure Medical, but we do sometimes a blood test, or maybe you've already had it done, and there's not a really clear level where we know that you would benefit with testosterone replacement. It's usually if your testosterone seems low based on your symptoms, you take a testosterone replacement and see if it resolves it. Just like if your blood pressure is high, see what medication works.
Yeah.
The most common ways that we do this is with a pellet. It's like a little piece of rice that goes in, like kind of in your skin of your buttocks, or as an injectable every week. We find that a lot of men like to do the pellet because they do it for the last 5-6 months.
Right.
And some men decide they really want to do an injectable every week. So it's really a personal choice. There's not, I would say, benefit of one over the other.
Yes. Now, no offense, men. You aren't as tough as us ladies when it comes
that's right, yeah.
to doing stuff. So I'll ask the question, does it hurt? Are they going to be like, ooh, I don't know? Yeah,
so the shot is a shot.
Right.
The pellet, we numb you up for. So the pellet is probably the most painless one.
Yeah.
Most guys can tolerate that quite well. They might feel a little soreness for a couple days, but it's very well tolerated. It doesn't hurt
much.
And
it's like short. I mean, it takes like 10, 20 seconds. I mean, it's not like
it's
a long thing, you know what I mean?
Yeah, less than a minute.
Yes.
Yeah, less than a minute.
And I mean, maybe a little discomfort for a few seconds is worth it if all of these symptoms that you just described that do not sound like a good time could get better. Yeah,
the procedure itself doesn't hurt, but it's a little soreness afterwards. It feels like a bruise. And your symptoms usually improve within about 2 to 4 weeks. And that's when we really can judge how this is working for you. And it's really, the dosing is pretty simple. It's 10 milligrams per pound. Yeah. And that works consistently, and then you kind of set it and forget it.
The next question, they're probably like, okay, this sounds really good. What about the cost? Am I going to be able to afford this?
Yeah, great question. So the cost is somewhere between $1,000 and $2,000 a year. Typically, your insurance won't cover it, except unless certain extenuating circumstances. So most men just pay out of pocket, and it's generally less than a cell phone bill. But again, between $1,000 and $2,000 a year, $100 to $200 a month.
Hey, to feel better, I mean, can you put a cost on that?
That's right, yeah.
You can't. And where could people get your book too, Doctor?
So you can go to Allure Medical. If you Google Allure Medical books, you'll be able to download a free copy of the book. It explains really all the science behind how we understand testosterone replacement in men currently.
I love it. If they want to go ahead and make an appointment and see if they can, qualify and get the testosterone, what should they do as well? Go to Allure Medical?
Go to Allure Medical, you make an appointment, we'll evaluate you, and if you have some prior blood work, bring that in, and you'll meet with one of the providers, and they'll go over your options.
You make it so easy and very conversational. Thank you so much.
Thank you.
Yes, we appreciate it.